The first cold drop of blood hit the polished operating room floor before anyone spoke the word impossible. It landed beside the polished boot of a decorated colonel who had spent the last 30 seconds shouting orders instead of looking at the patient whose heartbeat was slipping away beneath the sterile green drapes. Around the operating table, metals flashed beneath harsh white surgical lights, expensive watches caught nervous glances, and polished insignias reflected a hierarchy that suddenly meant very little against the relentless rhythm of a failing heart monitor. The man lying motionless beneath the surgical sheets was one of the nation's most respected four-star generals, a commander whose decisions had shaped wars, protected thousands of lives, and inspired generations of soldiers. Yet in that room, stripped of his uniform and unconscious beneath anesthesia, he was simply another human body running out of time. The emergency had arrived without warning less than 15 minutes earlier after a classified live-fire training exercise ended in catastrophe. Reports were incomplete. Witnesses contradicted one another. Everyone agreed on only one fact. If surgery did not begin immediately, the general would not survive the hour. The problem was that the hospital's chief trauma surgeon had become trapped across the city after a tanker accident shut down every route leading back to the medical center. Every minute stretched longer than the last. Every delay carved another piece from the general's chances. Phones rang without pause. Officers demanded updates they could not receive. Administrators whispered about responsibility, careers, investigations, and headlines that had not yet been written. Standing quietly against the far wall was Second Lieutenant Emily Carter, a young combat nurse whose uniform carried almost no decorations beyond the faded ribbons earned during 2 overseas deployments. She appeared younger than most expected a military nurse to be. Her dark hair disappeared beneath a surgical cap. Protective glasses hid tired eyes marked by too many sleepless nights. There was nothing dramatic about her appearance. She neither demanded attention nor attempted to earn it. She simply watched. While others argued over authority, she studied the injury itself. The portable scans displayed fragments of torn tissue, damaged arteries, and scattered metal embedded deep within the general's chest. Experienced physicians focused on the obvious wound where blood continued pooling despite temporary pressure. Emily noticed something different. A barely visible shadow near the heart shifted slightly every time the ventilator expanded the general's lungs. It was subtle enough to escape exhausted eyes. She leaned closer. Again the shadow moved. Not randomly. Deliberately. Something lodged inside the chest cavity was unstable. Waiting could change its position. Cutting from the planned angle would push it directly into the heart. Her pulse quickened, but her voice remained steady. She quietly informed the attending surgeon that the fragment appeared dangerously mobile and recommended altering the surgical approach immediately. The older physician barely looked up from the monitor before dismissing her observation with a distracted nod. Protocol had already been established. Specialists had reviewed the scans. There was no time for debate. Emily stepped back, but her eyes refused to leave the image. Memories she rarely allowed herself to revisit surfaced without permission. Desert dust. Helicopter blades beating overhead. Flashlights replacing surgical lamps because electricity had failed. Young soldiers whispering that they did not want to die alone. She had seen metal behave exactly like this before. Tiny fragments became silent killers because they waited until the first incision redirected them into places no surgeon could repair. She remembered an elderly field surgeon placing a blood-stained scalpel into her trembling hands years earlier after an explosion overwhelmed the combat hospital. There had been no specialists. No consultation. Only impossible choices measured in seconds. She remembered his calm words more clearly than his face. Learn to see what panic cannot. Those words had remained with her through every deployment, every evacuation flight, every impossible night when survival depended less on confidence than observation. Back in the operating room, alarms interrupted her thoughts. The general's blood pressure fell again. Nurses exchanged fresh transfusion bags with practiced speed. The anesthesiologist frowned at the monitors. Another surgeon hurried inside, still fastening his sterile gown, only to announce that the chief surgeon remained at least 20 minutes away. 20 minutes sounded ordinary until someone quietly calculated that the patient probably had 6. Anxiety spread through the room like invisible smoke. The colonel nearest the operating table demanded immediate action. Another physician insisted they continue following the original plan. Administrators argued over legal authority if the chief surgeon remained absent. Nobody noticed Emily studying the monitor once more. The shifting shadow had moved farther. It was exactly where she feared it would be. She walked to the display, enlarged the image, and pointed silently toward the tiny sliver glimmering beside the damaged artery. This time several doctors looked more carefully. One frowned. Another leaned closer. A third shook his head, unconvinced. The debate lasted barely 20 seconds, but 20 seconds inside a dying body could become forever. The heartbeat became weaker. Blood continued disappearing faster than it could be replaced. Emily spoke again, louder now, explaining that the fragment had migrated since admission. If they entered through the planned incision, pressure would force the metal into the heart wall. The room answered with silence followed by disbelief. A senior surgeon asked where a nurse had learned such surgical judgment. Another officer reminded everyone that battlefield experience did not replace medical authority. Someone quietly suggested removing her from the operating room before emotions disrupted discipline. Emily accepted every word without argument. She had heard similar doubts before. Rank often spoke louder than evidence. Yet the monitor refused to care about military hierarchy. It continued counting down the general's remaining chances one heartbeat at a time. She looked toward the unconscious man whose weathered face revealed nothing of the countless decisions he had once made under pressure. In sleep, even history became fragile. She wondered whether he had ever known the names of the nurses who had cared for wounded soldiers beneath his command. Perhaps he had. Perhaps he had not. It no longer mattered. What mattered was the artery slowly surrendering beneath damaged tissue and the silent piece of metal drifting toward catastrophe. Another alarm sounded. Louder this time. The anesthesiologist announced worsening cardiac instability. The room erupted again. Orders overlapped. Gloves snapped into place. Surgical instruments clinked across polished trays. Emily felt the familiar narrowing of time she had experienced on distant battlefields where every distraction disappeared until only the patient remained. Her breathing slowed while everyone else's accelerated. She stepped beside the sterile instrument table. Rows of shining tools reflected the operating lights like tiny mirrors. Among them rested a single scalpel waiting for hands officially authorized to hold it. Her fingers hovered for only a moment. Then they closed around the instrument with calm certainty. Gasps broke across the room. Chairs scraped backward. The colonel shouted for her to put it down immediately. 2 surgeons moved toward her. The anesthesiologist looked from the collapsing monitor to the young combat nurse whose eyes held neither panic nor defiance, only absolute conviction that another 5 seconds of hesitation would decide whether the nation lost one of its greatest commanders forever. The operating room became unnaturally still, as though every machine had paused to listen before deciding whether life or death would speak next. Emily Carter held the scalpel without flourish, her grip relaxed, her breathing measured, while every pair of eyes in the room settled on the youngest person present. No one rushed toward her now. The colonel who had shouted only moments earlier stopped mid-step when another sharp tone burst from the cardiac monitor. The general's blood pressure dropped again. A nurse called out the numbers, each one lower than the last. The anesthesiologist adjusted medication with practiced precision, but the response never came. Instead, the heartbeat grew weaker, slower, less certain. Time, which had already been slipping away, suddenly began falling in great silent pieces. Senior physicians exchanged anxious glances. Regulations had always been clear. A combat nurse did not perform major surgery inside one of the nation's most respected military hospitals. Careers had been built upon following that rule. Careers could disappear for breaking it. Yet rules had never stopped blood from flowing. Emily looked only at the patient. She had seen this moment before, though never beneath spotless operating lights. Years earlier it had happened inside a canvas field hospital where rain leaked through patched fabric and generators failed every few minutes. Wounded soldiers had arrived faster than helicopters could carry them away. Supplies disappeared. Morphine ran short. Experienced surgeons collapsed from exhaustion. That night an elderly trauma specialist had suffered a heart attack beside the operating table after saving lives for nearly 20 straight hours. Before losing consciousness, he had pressed his own scalpel into Emily's trembling hand. There had been no speeches, no dramatic declaration, only quiet certainty. You already know enough to keep him alive. Do not waste time pretending you do not. She had wanted to refuse. She had been only a nurse attached to a combat rescue unit. Yet there had been no one else. Under whispered guidance from medics and fading instructions from the surgeon lying beside her, she had opened a soldier's chest, controlled catastrophic bleeding, and somehow carried him through until evacuation arrived. She never told anyone afterward except the official investigator whose classified report disappeared into military archives. There were no medals. No celebration. Only another deployment. Another battlefield. Another wounded stranger needing steady hands instead of recognition. Back in the present, none of those memories appeared on her service record. To everyone around her she remained simply a young nurse standing where she should not be standing. The senior trauma physician extended his hand toward the scalpel. His voice remained controlled despite the panic tightening beneath it. He ordered her to step aside. Emily met his eyes for the first time since entering the room. She spoke quietly enough that everyone leaned forward to hear. If you open through the current approach, the fragment will strike the ventricular wall. He hesitated. Not because he believed her, but because she sounded as though she had already watched it happen. Another alarm interrupted the moment. The general's pulse became dangerously irregular. The anesthesiologist glanced from the monitor to the scans still glowing across the wall. His face tightened. He enlarged the imaging once more. The tiny metallic fragment had shifted again. Barely. Almost invisibly. Yet it had moved. A younger resident noticed it too. Then another physician. The room no longer argued about whether Emily had imagined the movement. They argued about whether there was enough time to change the surgical plan. Every option carried terrible risk. Every delay guaranteed worse odds. Then something unexpected happened. Colonel David Monroe, a veteran anesthesiologist with nearly 40 years of military medical service, removed his eyes from the monitor and looked directly at Emily. He had worked in combat hospitals before many of the younger doctors had finished medical school. He recognized something they did not. It was not confidence. It was familiarity. Her calm did not belong to someone hoping she was right. It belonged to someone remembering. Without raising his voice, he addressed the room. If anyone else here has performed emergency thoracic intervention under active combat conditions, speak now. No one answered. Silence settled over the operating room. Not uncomfortable silence. Heavy silence. Honest silence. Machines continued their relentless rhythm while experienced professionals searched themselves for certainty they suddenly realized they no longer possessed. Colonel Monroe nodded once. Very slightly. Then he looked toward the lead surgeon. Either we trust observation or we certify his death before the chief surgeon reaches this building. The words landed harder than any shouted order. The lead surgeon stared at the monitor. Regulations battled responsibility inside his expression. Finally, he stepped backward. Just one pace. It was enough. Emily moved immediately. There was no celebration, no victorious expression, only complete concentration. She placed the scalpel exactly where the altered approach required. Her first incision was deliberate, controlled, astonishingly precise. The operating room transformed. Doubt gave way to disciplined teamwork. Instruments appeared in her waiting hand before she requested them. Suction cleared the field. Retractors opened carefully. Every movement became economical. She spoke calmly, never raising her voice, explaining each step before taking it. The physicians surrounding her gradually stopped correcting her, and instead began anticipating her needs. The wound revealed itself layer by layer. Blood obscured visibility, then cleared beneath careful suction. Torn muscle separated. Damaged tissue emerged. Emily slowed. Her breathing remained even. She lifted one gloved hand slightly. Everyone froze. No one spoke. The room entered a moment so quiet that even the monitor seemed distant. Beneath the damaged artery rested the metallic fragment. It had not lodged where the original scans first suggested. It had migrated into a narrow pocket of tissue exactly along the path Emily had predicted. Had the original incision been used, surgical pressure would have driven the jagged piece directly into the heart. The lead surgeon stared without speaking. One resident quietly removed his glasses as though unable to trust what he was seeing. Emily reached forward with delicate forceps and secured the fragment before it shifted again. It was no larger than the tip of a finger, blackened from heat, irregularly shaped, almost insignificant in appearance. Yet it possessed enough destructive potential to end the life of one of the nation's highest-ranking officers. Colonel Monroe exhaled slowly for what felt like the first time in minutes. The lead surgeon closed his eyes briefly before opening them again. He did not apologize. There was no time. Instead, he simply said, "Continue." The operation entered its most dangerous phase. Blood loss remained severe. The damaged artery required immediate repair before irreversible shock set in. Emily directed clamps into place with remarkable composure, while experienced surgeons now worked beside her rather than above her. Respect had arrived without announcement. It simply appeared through competence. Then, as she carefully exposed the deeper injury, her expression changed for the first time. Hidden behind the torn vessel lay another wound no scan had fully revealed. A second shard had penetrated deeper than anyone imagined, resting against a section of the aorta that could rupture with the slightest mistake. Emily understood instantly what it meant. The first fragment had never been the true threat. It had been hiding something infinitely worse. The room had been preparing for the wrong operation all along. The second fragment seemed almost invisible beneath the thin curtain of darkened blood, no larger than a broken fingernail. Yet every experienced physician surrounding the table immediately understood the danger once Emily exposed it. The jagged piece of metal rested against the wall of the aorta like a stone balanced at the edge of a cliff. It had not pierced completely through. It had merely waited, held in place by damaged tissue and pressure that could change with the slightest movement. Had the original surgical plan been followed, the fragment would have shifted, the vessel would have ruptured, and no amount of skill inside that operating room could have restored the life slipping away beneath the green drapes. For a long moment no one spoke. Even the colonel who had questioned Emily's presence stood motionless, his eyes fixed on the tiny shard that had rewritten everything they believed about the injury. Then the operating room awakened again. Instruments moved with renewed purpose. Nurses anticipated requests before they were spoken. The lead surgeon, who only minutes earlier had ordered Emily to step aside, quietly positioned himself beside her and followed her direction without hesitation. Pride had no place left in the room. Only responsibility remained. Emily studied the damaged vessel with extraordinary patience. Every movement became smaller than the one before it. Her hands seemed untouched by the panic surrounding them. The years she had spent in combat hospitals had taught her that fear was not defeated by courage alone. It was defeated by concentration. She remembered nights beneath distant skies where dust settled over open wounds before helicopters could arrive, where flashlights replaced operating lamps, where strangers trusted her with their final hopes simply because she happened to be standing nearby. She remembered faces she never learned the names of. Some survived. Some did not. Every one of them had left something behind inside her, not as scars but as quiet teachers reminding her that every patient deserved the same steady hands regardless of rank, uniform, or history. She guided the forceps toward the second fragment. The operating room became so still that the faint hiss of oxygen sounded impossibly loud. The anesthesiologist watched the monitor without blinking. One nurse silently counted each heartbeat as though numbers alone could keep the rhythm alive. Emily paused, waiting for the exact instant between two pulses when the vessel relaxed ever so slightly. Then, With a movement almost too delicate to see, she lifted the fragment free. Nothing happened. For one terrifying second, everyone feared the vessel had already ruptured. Then the monitor continued its measured rhythm. Blood remained controlled. The aorta held. A collective breath escaped the room, not in celebration but in profound relief. The hardest part was not over, but it had become possible. Working alongside the lead surgeon, Emily repaired the damaged vessel stitch by careful stitch. Minutes passed unnoticed. Outside the operating suite, anxious officers, government officials, and members of the general's family filled waiting areas with whispered prayers and unanswered questions. News organizations had already gathered beyond the hospital gates, unaware that the fate of one of the nation's most respected military leaders rested in the hands of a nurse whose name appeared nowhere on their lists of distinguished surgeons. Nearly 3 hours after the operation began, the final suture was secured. The bleeding had stopped. The repaired vessels remained stable. The heartbeat that had once threatened to disappear now echoed across the monitors with quiet strength. No one applauded. No one spoke above a whisper. Inside medicine, the greatest victories often arrived without noise. Emily removed her gloves slowly and stepped away from the table, allowing the surgical team to complete the final stages of closure. Only then did she feel the weight of exhaustion settling into her shoulders. It was the familiar exhaustion that came after impossible nights, the kind that arrived only when responsibility finally loosened its grip. Colonel Munro approached her first. His expression carried neither surprise nor admiration alone. It carried recognition. He had seen many extraordinary people during decades of military service. The remarkable ones never announced themselves. They revealed themselves only when circumstances stripped away titles and left nothing except character. He thanked her with a simple nod. She returned it just as quietly. Several hours later, the chief trauma surgeon finally entered the recovery unit after fighting impossible traffic to reach the hospital. Instead of anger over the broken protocol, he asked for every scan, every operative note, and every recording from the procedure. He reviewed them carefully, saying almost nothing. When he finished, he requested Emily's complete personnel file. The documents surprised everyone who read them afterward. Years before becoming a combat nurse, Emily had ranked among the most gifted surgical residents in a prestigious military training program. Professors had predicted an extraordinary academic career. Then tragedy had altered her path. Her older brother, an army medic, had been killed while evacuating wounded civilians during an overseas mission. Rather than completing the comfortable career waiting for her, Emily voluntarily transferred into frontline combat medicine, believing that the place where skilled hands were needed most was also the place where fear was greatest. She never returned to finish the final certification required for formal recognition as a military surgeon. She never sought special consideration. She never mentioned the operations she performed under battlefield necessity because every classified mission remained locked behind silence. She simply continued serving wherever the military assigned her. The following morning, the 4-star general regained consciousness. His family gathered beside the bed, relief washing across faces that had spent the night preparing for unbearable news. Though weak, he immediately asked who had performed the operation. The room hesitated. Finally, the chief surgeon answered truthfully. It was not a celebrated specialist. It was the young combat nurse standing quietly near the doorway, hoping to leave unnoticed before anyone remembered her name. The general turned his head toward Emily. His voice remained faint, but every word carried unmistakable sincerity. He thanked her not only for saving his life but for refusing to surrender to the comfort of obedience when obedience would have cost a man his future. Later, after investigators confirmed every detail of the operation, military leadership offered Emily promotions, commendations, and public recognition. She accepted the formal acknowledgement because it honored every medic and nurse who had ever worked without applause, but she politely declined requests for interviews and ceremonies celebrating her as a hero. She made only one request. She asked that additional advanced surgical training be made available for combat nurses serving in remote deployments, so that future emergencies would leave fewer lives dependent upon impossible luck. The request surprised many officials. She could have asked for rank. She could have asked for prestige. Instead, she asked for preparation on behalf of strangers she would probably never meet. The recommendation was approved. Months later, newly expanded battlefield surgical training programs quietly began across several military medical centers. Most participants never learned the story that inspired the change. Emily preferred it that way. Her greatest accomplishment was never becoming famous. It was making sure the next frightened medic standing beside a wounded soldier would know just a little more than she once had. Before leaving the hospital that evening, the general walked slowly through the corridor with assistants, still recovering but determined to thank every member of the medical team personally. When he reached Emily, he paused for a long moment before saying the words many in the hospital would remember for years afterward. Rank may open a door, but character is the hand that saves the life waiting behind it. Those who heard the sentence repeated it often, not because it sounded poetic, but because they had watched it become true. As the sun settled beyond the hospital windows, its golden light stretched across the now quiet operating room where the crisis had unfolded. The monitors were silent, the instruments had been sterilized and returned to their places, and only the memory of steady hands remained in the stillness. Some victories are written into history books, while others are carried forever inside the hearts of the people who witnessed them. If this story reminded you that compassion and courage often wear the humblest uniform, then perhaps the next story we share together will remind someone else to see greatness before the world learns its name.